here, your N, when it was 5 years. I don't know if the change from 5 years to 6 years has made it, I don't know the positives and the negatives of that. I know there's a positive, obviously, because the calendar used to be quite hectic for us, but maybe it has become a bit more manageable, but also things take a bit longer. So yeah, came in first year. Reality check of med school for me was mostly, I would say, third year, because that's when we would get to the wards for the first time. And that's when I realized, first of all, what kind of a healthcare system we are in. I must say I'm a bit lucky because up until then, probably my visits were more private hospital and that kind of thing. A little bit of public maybe on a smaller scale. So, but again, when you see what is happening to patients, you start to realize there's a lot of work that has to be done. And also just being overwhelmed, because I think it's no secret, we know how KNH runs and a lot of other public facilities. So you wonder, if this is a top facility, what are we really trying to achieve here? So I think third year, fourth year, my inclination started to go towards research because I felt, okay, clinical is good, but you're not able to solve problems, especially in this setting. So let me start gravitating towards research. And I was I think it's also good to be a bit aggressive. I reached out to some of the nicer consultants, if I can say that. I can mention a few. Professor Ndwati, Ruth, I think she's still here. Yeah, so she's wonderful as a human being, because that's what I was looking for. I told her, you see, you're presenting amazing things, research. I want to be in this research thing. I had no idea. Because again, if you go back early in med school, second year, when you start being introduced to research methods, again, it's not taught well, let's just be honest. So you don't really know what research entails. So she was kind enough to, and it also helped because we were a group. So she's like, there's a lot of research work I have. I just need people to do like data collection or whatever. Like, yeah, we'll do whatever. I mean, we just want to be exposed. And that's when I began even attending some sessions at United. United is still here, right? I think it's this one maybe. The actual camera phone. No problem. So United is right next door here, right? There's also a Dr. Joshua Kimani there. They were presenting all this research work they're doing. Kavi, which is not far from here, got to hook up with Akina, Prof. Anzala and the rest, and I realized, okay, this is where I see my career going. I actually said, this is exactly, I don't know if any of you has experienced any of those that I've mentioned or anything close, because there's a lot. I think there's University of Washington, UCSF, there are many, all those research entities, KEMRI, of course. So I made a decision, it's research. So we are working hard to finish med school. Fifth year comes, we survive, is that the word? Because some of those exams are not easy. So, sorry? Still are not, of course, yeah. Then choosing internship, I think things have changed a bit. It used to be a little bit easier for us, I would say, from what I had. Because for us, there were allocations and you could select a particular institution. I think from what I had, there's a wheel that is fun and it's a bit more random, if I'm not, or he said, yeah, so he understands what I'm saying. Yeah, I think from what I heard from those who have interacted with on that, it's a little bit more random. You see, in our time, you could say, I want Machakos, and you could kind of get it. Because I guess the numbers were fewer, and it was just Nairobi and Moi, end of story. Now you have, I think, 11, so it has to be more random. So I was able to select Mbagathi. I was deliberate. Number one, I wanted to remain in Nairobi because I saw all the research ecosystem, as I can call it, was here. KEMRI, Nani, everyone was here. And really didn't see the value of going very far. That's for me. Yeah, so Mbagathi was new. We're actually the first medical interns 2009. So internship went pretty okay. Then the posting came. So again, something that changed. I know these days the posting is quite dramatic. From what we saw even early this year, I think it's in batches and it's not very well done. So posted to Olenguruone Sub-District Hospital. For those of you who are on Google, you can check. Basically, you have the Mau Forest. Right in the middle, there's a town called Olenguruone. That's where I was posted. And during our time, a lot of people are very quick to quit government because we are the pre-KM PDU, if I can say that. When salaries were 51,000 and 48,000 and some other figures like that. So people are very quick to quit. Personally, I was like, before I quit, let me first work Gava a little bit because I also didn't feel private sector was, remember my path was research. So I thought, okay, let me just see what we can do here. And maybe I'll locum somewhere in Molo or somewhere nearby. So I go there, I'm posted as the boss. So you move from being an intern to medical officer in charge of the hospital and the district overnight. So you're like, okay, this is a lot of responsibility. But yeah, because I was posted as DMOH, and I'm sure the names have changed now. And yeah, District Medical Officer of Health and medical officer in charge of the hospital, yeah. So when I went there was no other doctor. They had not had a doctor, I think, for 6 months. The nurse in charge was the boss. So she handed over to me, which was weird because I'm like, you're handing over things that I don't even know what I'm supposed to do with this very long title. But then quickly you realize, everything just comes to your desk, sign this, then you start saying, hey, what am I signing? Okay. You go for meetings, that's the reality. I think people are posted without that. There's also that internship to posting gap in terms of people being told what should be done and all that. It wasn't very easy working there, and I could quickly see the problems that I thought were in, let's say, KNH and Bagathi, they are multiplied times 5 now when you go to such a hospital. So I said, okay, again, research. So I was very quick to get out of there. I applied to very many research entities, KEMRI, CAVI, you name it. It was not easy because a lot of them want some level of experience or maybe some level of luck. Finally, after 7 months, KEMRI welcomed Kilifi, called me for an interview, and eventually after like 2 months is when they responded. So, and by that time I was not having a very good time with they were called PDMSs, provincial district, before the devolution, because you'd come to the hospital with a lot of, complaints and issues, and kind of want me to be there the whole time, and I'm like, this is not possible. So anyway, so I went to KEMRI, and I was so happy. KEMRI has happened. This is my career path. So we're gonna do KEMRI, we're gonna do masters, we're gonna just continue with this. Nothing like bioMérieux and Novartis had ever crossed my mind. It was actually not in the plan. But then after 2 years in KEMRI, 2.5 actually, I noted one of my colleagues, he was 2 years ahead of us in med school. He was working at KEMRI CDC, and he had just quit to join GSK. I think everybody knows GSK, right? Pharmaceutical company. And I was like, what kind of a move is that? So I asked him, what are you doing? He said, medical advisor. What is that? What are you advising? So he tries to explain the job description. So I'm like, okay, we have med reps, and then we have you. What is the difference? He again tries to say, there's commercial interaction, scientific interaction. This is 2012, so it's still very new. And even now, explaining our job sometimes is not easy. So I was just more intrigued, and I thought, okay, that sounds like a new thing, and sometimes new things are not bad. Probably another lesson to think about. So I told him I'd be interested, and I did end up going for 2 interviews, one that didn't go well, and then now the Novartis one that went well. And in KEMRI, Kilifi, I'd just been promoted from what you call first on call physician, MO, to second on call. And I have this offer letter from Novartis. And I'll be very blunt. So some people are like, how much money have they offered you? Because how can you leave Kemri for medical advising or whatever they're calling that? Because this is 2012. Nobody understands what you're really taking. And even I'll be honest, I didn't quite get what the role entailed, because there were very few. Back then, there were actually 10, about 9, 10 medics in all the pharmaceutical companies in Kenya. It's amazing that now we've grown to about 80. So it's amazing. Like, it was something very small, and now, I think a few weeks back, Huaida was here, Peter Mburu, so those are the kind of people. So yeah, I looked at Novartis. Yes, I will be honest, the contract was very attractive. And remember, this is 2012, so the first KMPDU strike was December 2011. For those who have their history, that was the first strike that made a change, yeah? So KMPDU, with all its problems, I know they are there even now, but they made a very big impact in 2011, because that was the first strike that really transformed a lot of issues. KMPDU became strong. So as we were still pre-KMPDU, so some of these contracts you get from Novartis, and you're like, okay, that's nice, I'll sign up. So start your job. And I actually didn't start as a medical advisor. I started as what is called medical science liaison. Again, more complexity. So we have, let's say, Professor Andauti, she's there. There's the med rep, then there's me. And then, so the first issue was the job entailed being out there, discussing more scientific aspects that are related to the drugs, studies, CMEs, symposia, and such things. So picture this. So you go to Professor Ndwati's clinic in Upper Hill Medical Center, let's say. There's that nice waiting area. Usually it's with patients. Usually it's patients, and then half is pharma industry. Then you're there in that corner of pharma industry. And some of these senior consultants, they really don't know me. So they come and they say, I want to see that one and that one. And that's the end of the day. So I am sitting there. Nobody really has recognized my presence. I remember even trying that thing of, you go to the secretary and say, I'm the medical what. Then she's like, he sees med reps on Fridays. Kindly come on Friday. So I remember asking myself, okay, what have I signed up for now? Because, you're the doctor, MBCHB, and now you're being, let's use the word, reduced to, just wait there, you'll be seen. So it's very easy to quit. And I think a lot of people, not just me, some of them are like, that's a fake job,